a lot of the programs you talked about were more for the older individuals and such, but so many of our behaviors and what really puts people into high-risk groups start to develop at a very early age, and that brings to light the importance to reach the public at a very early age. And I think that one of the key things in our role as educating the future of health professions across all the disciplines basically here at Jefferson is that how do we instill in them that it's equally all of our responsibility to provide some level of public education and to look at agendas where we can start to create healthy behaviors early in life and not wait to try to change those behaviors, because every one of us knows that changing behaviors becomes much more difficult the older that we get. And so it is very, very important, I think, to also look at how we can touch lives long before they're ever the employee of anybody, long before they ever even know about health insurance and these issues as well. So I think that's one of the things that it would be very interesting to look at collectively what we can do in terms of restructuring our educational programs to make sure that all of our graduates of all of our programs are prepared to go out and do these things. And I think that one of the neat things about being at Jefferson is that this tremendous sense of a community and responsibility to making our community a better place across all the disciplines here. And it really kind of raises that bar and creates a challenge, I think, for us all to figure out how we can start to create a positive impact. One of the things that we haven't really discussed, and that keeps coming to mind, because I'm a pharmacist and that's where my background has been, but I spent the first 20-some years of my career strictly in oncology pharmacy, and I keep thinking about the healthcare costs of things that may be associated with behaviors and smoking and things like that, but a lot of catastrophic illness is not associated with behaviors, and so I think we can't forget about that model, that side of the healthcare equation as well too, and the rate of rise of costs on that side of the equation too. One of the things I think that would, and if you have an opportunity to comment at the end, one of the questions I would have is, obviously these are great initiatives, and what's the cost offset in terms of how much of the infrastructure we have to create to put programs in place, and how much of the spending does that offset? So, what's the net increase or the net advantage of programs, and per person, how much does it cost to create these programs and oversee them, and how do we build that into the model of healthcare? Again, I think I wish that we could bring you into every one of our classes so that you could talk to our students, and unfortunately, because the semester was over last week, we don't have too many here on campus, but this was wonderful, and thank you very much, and we are deeply appreciative to your entire organization. This is very exciting stuff.
Great. Becky, thank you. Mary, okay, batting cleanup.
Well, the good part about following my two esteemed colleagues here is they've said it all, but I'll try and elaborate from my own perspective as having my nursing career focused on public health and community health, which these are the issues that we have historically, since the beginning of time practically, been speaking about the health status of our people, of our nation. We are not a healthy nation. We all know that. And when you look at we spend the highest per capita in the world on healthcare for our people, and we're way down the list in terms of healthy outcomes for our population. Two things that Mike said that kind of resonate in my mind, and they are that we need to be changing the health status of people, and that we need to have sustainable behavioral change. Unfortunately, these are the things that we've been trying to cope with for at least the whole length of my career, which is a long time. And I think that we resonate with some of the things that both Janice and Becky have said. why? Why aren't we doing this? And why aren't we able to accomplish better outcomes? And I think that we have to be able to go back and basically address the underlying issues that Mike was talking about in his presentation. But again, as Becky said, go back to the beginning. We need to be working with our children as well. We need to be, so therefore, we as healthcare providers can't work in isolation, but I think we have to set up collaborative endeavors with families, with our educational systems, that we begin to address health at a very early age. And I think the other thing that we have very special here at Jefferson is that we're taking, I think over the past few years, we've been really being upfront and looking at some of the issues that Janice brought to light, that we're not a healthcare system, we're an illness system. We focus on illness. We wait till people become ill. We're not focusing on the preventative areas that we need to. We need to prevent these illnesses from happening to prevent the cost to society of these chronic illnesses. Here, I believe we are at a point where we're making inroads in our approach to educating our healthcare providers of tomorrow, whether they be physicians, nurses, whether they are members of the pharmacy profession, occupational therapists, the physical therapist. In other words, all the students we educate here at Jefferson to look a little bit differently at what their future should be, what they should be doing as a provider of care, and to focus and to bring efforts forth to look at this team approach to healthcare, where we are working with individuals before they become ill, that we are able to address these issues and prevent them from happening early, and then if they do happen, the early intervention before they become chronic problems. So I think that we're making wonderful strides here, but we have to, this can't be just Jefferson who does this. We have to work with our providers across the country to have them look at the models that we are trying to implement here to support those models of education, and then help us to institute them in the practice setting, to provide the resources that are needed, to look at the research that demonstrates different approaches to prevention of illness, to early intervention, to early detection, and then how do we use the skilled teams of practitioners to intervene when we do have illness, but to work with people beforehand. So I think that it's an excellent opportunity this afternoon to explore what one company is doing out there, and we congratulate you on that. And then how do we move that to more of a national philosophical orientation?
Wonderful.
Thank you.
Very wonderful. How about a round of applause for our panel? I'm going to ask you ladies to stay right there if you would. And Mike, if you want to make some comments back, that'd be wonderful.
Let me just quickly respond to that last comment because it's important. You know, this will only start really having any traction when it becomes more of a movement as opposed to a bunch of ideas and a bunch of projects. And so, you know, for example, we're working in a relationship with the Clinton Foundation on childhood obesity, because you're absolutely correct. We're also working with a couple of magnet healthy schools in our hometown, trying to figure out how you can affect this subject, especially obesity in kids, trying to get in there early. And what you learn pretty quickly, some things happen that are both good and bad. There's interest in this, but you also run real quickly into the educational system, which has its own set of problems when you try to go there to work with it. But put that aside for a second. You know, these kids they, in my opinion, you'll have a movement on the concept of health and wellness and obesity management when the curriculum in the 5th grade math class is built around counting calories or something related to health as opposed to two cars going in opposite directions at a certain speed.
I could never figure that one out anyway.
Right. That's when you've got a movement, when you have figured out how to embed it in everything, so that it's not something you think about as you're doing it and being a part of it without having to concentrate on it. And so everywhere we go. I also like this concept, and I took this to the magnet schools, and they kind of looked at me like I was nuts around the idea that these kids are not going to suddenly go from eating awful things to great things. I just don't believe they can do that. So let's teach them, the best choices amongst a bunch of bad choices. So if you're going to walk into McDonald's in the morning, what should you choose? Eat this one and not that one, because there's a huge variation in what goes on. So I think it's a combination of lots of things, and some of it's going to be the social networking implications. I'm a big believer that whole thing is going to get very, very big and ubiquitous in our lives, and it's going to start touching a lot of things, and to the extent we can have part of that agenda driving behaviors. And we're starting to see it in the bike world, frankly. These bike people are starting to get very, very connected, and they arrange to meet at certain times to go do things, and it becomes a support system. And then you bring in the Facebook implications of the bike people talking to each other, and the Twittering and this, and all those things that are going on, I think are also going to be very, very powerful on this subject, because that's the way people are living their lives. And the cell phones is something, I come back to it. There's more cell phones in China than there are computers. It's amazing. Every one of our kids have cell phones. We all have them. They're getting smarter, cheaper, faster all the time. There's an opportunity there that's going to be really, really big. There's a viral thing that can be going on here too. This is inside of our company again. We basically said, the pedometer program I was telling you about, we offered 180 people the opportunity to begin participating in a pedometer program as part of that whole new thing. 140 of them took it up. And virally, over the course of the next 2 months, 4,000 people ultimately took it on and became part of that community just like that. So I don't know what you have to do with that. It's pretty new information, but we'll figure something out. But
and you had to buy more pedometers.
And everybody had to buy them. We only gave them to the first 140. Everybody else had to go buy them and do all the registration and do all that stuff. So I don't know exactly where it leads, but it's comprehensive. But my point is, I think it's going to have to be a movement before it really gets traction. So.
Wonderful. Great. Any other comments from you?
You want to take any questions or not?
Sure.